What if the cheapest Medicare plan you can find actually ends up being the most expensive one? Now this sounds like it doesn't make sense, but it actually happens all the time. When most people choose a Medicare plan, the main thing they look at is the monthly premium. They may look at two plans. One has a $0 monthly premium and the other one has a $160 premium, for example. And they think, oh, well, that's an obvious choice, and they go with the $0 premium. But what many people don't realize is that that monthly premium is only part of the cost. And oftentimes, it could actually be the smallest part. And so depending on your health and how often you use your care, that $0 premium plan can actually be more expensive over the course of a year. So should you then choose the plan with the highest monthly premium? Well, not exactly. So in this video, I'm going to break down the two main Medicare paths. I'm going to show you what each path looks like in a good year as well as in a bad year. And I'm going to try and help you figure out which one can actually save you the most money depending on your specific situation. But to reach that point, you first need to understand the different types of costs that we're dealing with here. Now, many people think that Medicare comes with a certain price tag. So many people look at that monthly premium and just assume that that covers the entirety of their healthcare. And so naturally, when they see a plan with a lower or a $0 monthly premium, they automatically assume that, wow, that lower premium is going to cover just as much as something else, and so that's the better option. Of course, that makes a lot of sense. You see, we're used to things like our car insurance, streaming services, and other things just coming with a single monthly payment. We pay it, we get it, and we don't have to worry about it. But you see, Medicare doesn't exactly work that same way, because on top of your monthly premium, there are other costs that can show up as you use your plan. Things like copays, for example, are fixed payments that you make every time you see a doctor or get a certain test, for example. Coinsurance is another thing where you may be responsible for a certain percentage of a service that you receive. And another thing a lot of people don't consider is deductibles, where you have to pay out a certain amount before your insurance will kick in and start giving you coverage. Now, these costs can be small in a good year, but in a bad year, they can really start to add up really fast. So when you're comparing Medicare plans, the question isn't only which premium is cheaper. You also want to ask, what could you end up paying in a given year, especially if you have a bad year where you have to use your coverage quite a bit. Now, to help you understand these different costs, let's talk about those two paths that I touched on earlier. Now, the first Medicare path that I want to talk about is Medicare Advantage, also known as Medicare Part C. These are private plans that typically bundle things like your hospital coverage, your medical coverage, and even your prescription drugs all into one plan. And the nice thing is, a lot of them come with a $0 premium, which is one of the main reasons these plans are so popular. But one thing to be aware of with Medicare Advantage plans is that they often have copays and coinsurances that you're responsible for. And so as the year goes on, those costs can really add up and may end up costing you thousands of dollars in a given year. Now, another common path that people take is they have original Medicare, which is Part A and Part B, and then they combine that with a Medigap plan, and on top of that, they add a prescription drug plan, also known as Part D. Now, these type of plans typically have a higher monthly premium, and that's because you're going to be paying for that Medigap premium as well as your Part D prescription drug coverage on top of your Part B premium. But in exchange for that extra premium, Medigap plans cover a lot of the out-of-pocket costs that original Medicare does not. For example, the 20% coinsurance from Part B, or the hospital deductible from Part A. So for example, on a Plan G, the main medical cost you're responsible for all year is typically that $283 for your Part B deductible. After that, your out-of-pocket costs are usually about zero. So there you've got two very different paths. One has a lower monthly premium, but typically charges you more when you use it. And the other has a higher monthly premium typically, but helps you when a big bill comes along. You have a little bit more protection and coverage. But the big question still remains, which one actually costs less? So to help answer that, I'm gonna give you two scenarios and then help you kind of decide which bucket you fall into. In scenario one, let's say you're in good health. You go to the doctors once or twice a year for a checkup. You don't take any really expensive medications, and you're not seeing a specialist or getting any major tests done. So in a situation like that, a person on a $0 premium Medicare Advantage plan could actually save quite a bit of money. And so over the course of a year, let's say that person does pay a couple of copays out of pocket, their total out-of-pocket expenses for a year might only be a couple $100. Now we'll compare that to someone on original Medicare with a Medigap Plan G and a standalone Part D drug plan. Between the Medigap premium, the Part D premium, and the Part B deductible, they could easily be spending between $3,500 and $4,500 a year. And that's whether they use it or not. So for someone in this type of situation, the Medicare Advantage plan makes a lot more sense because they're not going to the doctors frequently, so they don't have a lot of out-of-pocket expenses. They don't have copays, coinsurance, things like that. So in this scenario, typically the Medicare Advantage plan is going to make more sense because they're not seeing the doctor a ton, so there may not be a lot of copays, may not be a lot of coinsurance and things like that. But now what happens if things get a little more complicated? For example, what if this person then gets diagnosed with a chronic condition? They have to start seeing multiple specialists, they have to get lab work done, maybe they have a hospital stay, and maybe they end up even needing surgery. This would be what we would call a high usage year. So a person like this who may be on a Medicare Advantage plan may end up having to pay additional copays as well as co-insurance if they're frequently visiting doctors and specialists and things like that. And just to give you an idea how much this could cost, let's say every time they see a specialist, they're paying, let's say, just a $40 copay, for example. Then let's say they have to, again, like we mentioned, go to the hospital. So now they're gonna be paying between $200 and $450, let's just say, per day they're in the hospital. And then let's say they end up needing more expensive treatments like, radiation or dialysis, things like that. They may end up even having to pay that 20% co-insurance on top of all those co-pays and hospital visits. And again, those costs can keep stacking until that person hits their out-of-pocket maximum. But now let's say that same person had a Medigap Plan G. They are paying that higher premium every month, but when they get that unfortunate diagnosis, their out-of-pocket spending for the year ends up only being that, let's say, $283. And that's it. The Medigap plan typically will cover the rest. So the plan that may have looked cheaper because of the lower monthly premium may actually end up costing that person more in a high usage year. Whereas although the Medigap plan had the higher monthly premium, it ended up covering a lot of the out-of-pocket expenses that person would have been responsible for. So now you can see the trade-off. A lower monthly premium or $0 premium can typically save you money when you're not using your plan a lot, when you're in good health. But in the long run, it could actually end up costing you a lot more if your health ever goes and takes a bad turn. Whereas a higher monthly premium may feel like you're overpaying until you actually need the healthcare. But there's something else you need to keep in mind that a lot of people don't think about until it's too late. So if you start on a Medicare Advantage plan, because you're healthy and you want to save money, that can actually work well for years. But if your health later changes, and you decide later that you want to switch to original Medicare with a Medigap plan, in many states, you'll have to go through what's called medical underwriting. And what this means is that the insurance company can ask you questions about your medical history. And then based on what they find, they can charge you more, they can delay your coverage, or they can even deny you coverage entirely. So the strategy of starting cheaper now and then switching later doesn't always work. And that's because by the time you want to switch, you may not be able to. On the other hand, Medigap plans are typically guaranteed renewable. And so what that means is that once you have a certain plan in place, the insurance companies typically can't cancel or change your plan. And that's regardless of what happens with your health. So now how do you figure out which path is right for you? Start by thinking honestly about your healthcare needs. Don't think about only where you are today, but think of where you might be in a few years. Consider how often you're going to the doctor. Do you have any chronic conditions that you're worried about? Do you take any expensive medications? And are you okay with paying a large unexpected bill, or could that cause financial strain for you? So if you're healthy and want to keep your monthly costs as low as possible, Medicare Advantage plans can be great options. However, if you use healthcare frequently or just want more peace of mind, knowing exactly what your benefits will be, then staying on original Medicare and adding a Medigap or Medicare Supplement plan can be a great option for the years to come. And I just want to reiterate, there's no single one option that's just best for everyone. So what I always tell people is don't just look at the monthly premiums, look at what a plan may cost you over the course of a year, and then plan accordingly. Now, another thing to consider is that regardless of which path you choose, you shouldn't automatically assume that the plan that you had last year will be the same as the plan that you will have next year. To learn more about what could be changing in Medicare this year, go ahead and check out this video. We'll see you there.